more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. Of course, AM Impact on Your Health is heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Hey, compression wear has been in our minds and thoughts over, maybe last 3 to 4 weeks. Brought to us initially by Vera Watkins, because she was talking about the human type. So we're going to switch some gears today and move into talking about your animals, in particular your dogs, and they have their own compression wear. Now, I thought that this was to be a stylish thing, but it's actually serving a practical purpose. You're going to be with Mr. Phil Blizzard today, talking about his neat invention called a Thundershirt. I did try to call Mr. Blizzard before I went on the air, and he may be inbound to his office. I warn you, in case we have any difficulty, we'll switch gears and move into a different format where we'll let you open up the show to you. I just warn you that this possibly is a switching gears show. Nonetheless, our guest today talking about Thundershirt for your dog. It turns out, I think this is a great idea. You'll see what I mean after we get to it this morning. Look, if in the conversation today with Mr. Blizzard, you are moved to want to ask a question or make a comment, the number, as always, will be 412-825-6262. That's 412-825-6262. Now, up and coming. Well, on Wednesday, good friend of ours, as you remember him now, gerontologist, who last month brought to us messages and information that at the time you certainly thought was valuable. You asked a number of questions over the airways about, helping out or preparing for, or what you need to be thinking about when it comes to dealing with elderly populations. It'll be more than likely very much informational if you have your parents who are in a similar situation. And you know what? Your siblings, your children may very well be listening to the same show and thinking about you. Because they call you part of the sandwich generation. You're sandwiched right in between your parents and your children, and guess what? You're next. So that's going to be on Wednesday. We'll be back with Dr. Eric Shapiro. Now on Friday, interestingly, and going hand in hand with this whole concept of what to do with the elderly, if you are elderly and you need some additional assistance, we're going to bring a representative to an interesting service company here called Home Instead. It's senior care that your insurance is actually paid for. Look, I'll be bringing this to you on Friday with Ms. Kathleen Oberst. And then guess who we made contact with? Now, I haven't spoken to her directly, but I certainly have spoken to Deanna Naylor, N-A-Y-L-O-R. You remember her. She's the Vice President of Fruit of the Spirit. It's a product we've been promoting since Deborah Ray first brought it to us back in November of 2009. We haven't really hooked up with Deborah since then, but we're going to hook up with her this month. On the 17th, we bring her back. She has been very busy putting a book together in collaboration with a doctor she hooked up with down in the Tampa area. Of course, his name is Dr. John Young, and also a female, I really don't know her, Aida Reyes, also a medical doctor. Deborah and those two individuals put together a book called Harmony. It goes right and is in keeping with the entire Fruit of the Spirit movement, put in words. And so we'll have Deborah talk about her new book called Harmony, Spirit, Body, Mind, Achieving Good Health by learning the lessons of balance from science and faith. And that'll be our discussion on the 17th with Deborah. Of course, we'll fill out the remainder of the month. It'll happen, and I'll let you know the moment we have a new guest scheduled and penciled into the calendar. I was away on Friday. Didn't hear a live show on Friday. I was very much involved in a conference down in the Washington, D.C. area. Actually, it turns out to be in the country, in Virginia, a town called Ohil. Oh, my goodness. Way out in the sticks. But when I was going through the USA Today for Friday, an article written in the USA Today really caught my attention, really caught my eye. And it just goes hand in hand with what I've seen in the past. Maybe you've seen it too. Headline. Now it's 2, 4, 6 column spread. Page 2, top of the page. These are the kind of headlines that I'm not surprised when I read them. How about this? Breakthrough cancer therapy is a go. It mentions for $93,000. Now, get a load of this. Breakthrough cancer therapy. And as you read on, as I normally do find in these kind of 6 column spreads, especially when it comes to cancer, we've got the medical community, we've got the media, everybody's in collaboration bringing this breakthrough therapy to you. Now, what does this breakthrough therapy consist of? It's approved by the FDA just on Thursday of last week. The first vaccine in treating prostate cancer, as they say, for any cancer, so I guess maybe not specific for prostate cancer. It's a $93,000 vaccine. It consists of 3 injections. The name of this substance is called Provenge, Provenge. Now, they say it doesn't prevent cancer, it doesn't cure cancer, but, and I'll read this entire couple of sentences to you, but studies show that the vaccine does help men with advanced prostate cancer live 4 months longer than men given a placebo injection, so says a gentleman by the name of Philip Kantoff. Now, they're waving pom-poms. They got their saddle shoes on in the medical world. This comes out of Boston's Dana-Farber Cancer Center. They are ballistic up there, celebrating this wonderful drug. Now, I'm just letting you maybe weigh in on how you might feel about it. They say that 4 months, well, that's a significant benefit for men with such advanced disease who would otherwise live only 22 months. And so I added the 4 months to the 22 months, and I come up with 26 months. I don't know how you come up and walk away from the article in any other way. If all things hold true with this miraculous miracle drug, get this vaccine, your life expectancy with advanced prostate cancer goes from 22 months plus 4, 26 months, and they are celebrating in the streets up at Dana-Farber. This is very typical. It's one of those articles that, yes, I'm used to seeing, but it just confirms the continual impression I'm left with, which is they just don't get it, do they? They don't get it. 4 months and $93,000, which, hey, if it's FDA approved, more than likely it's insurance covered. So what the heck? You'll never see that $93,000 anyway. 4 months. Wow. Anyway, that's a little recap of the article coming out of the USA Today from last Friday. I was in, you had beautiful weather in Pittsburgh. It was beautiful and gorgeous weather in Virginia also, as I was looking out the window, enclaved and completely ensconced, beautiful as it was outside. Hey, it was some wonderful information imparted inside, but boy, I wish it would have been a rainy weekend, all weekend. I'm sorry I said that, but I'm sure you had a good time. I learned a lot, but as to whether it was a great time, I kept thinking about being outside the entire time. So, look, let's take a short break. In the interim, We're going to go looking for Mr. Phil Blizzard. That's his name. He invented something for dogs. It's compression wear. It's got a special fancy name. It's called Thundershirt. Let's hope he's back in his office. He wasn't there before I went on the air. Let's see if he's there now. If not, hey, we'll switch some gears and be right up on speed as you normally can do. So be back in a minute. Let's find out what happened. Then this will be over.
Courtney? Dr. Courtney? Dr. Courtney?
Yes.
Okay, he's at a different number, and he's called me. I have him on the phone.
Oh, great.
I'll connect you up here, okay?
Sure. Phil.
Okay, you both should be on there.
Hey, Phil.
Good morning.
Hey, glad to hear your voice. I don't know. Are you on a landline, Phil?
Unfortunately, I'm on a cell phone, but it should be a good connection. Can you hear me okay?
I can hear you okay. If you want, if there's a landline available, I could call you on a landline if you'd like.
No, unfortunately, I had to do some business travel last second here, so I've made different arrangements.
Look, okay, we'll be okay with this. We're on a little bit of a commercial break right now. Thanks for calling in. I'm always never sure how this thing works out when you know what he had in advance notice. It worked out fine. I'm gonna turn away from you. You're gonna be thinking I'm gone. I'm not. We'll come back with a little bit of intro, and we're gonna be off talking about you first and Thundershirt second. Okay?
Sounds good.
Okay.
Cutting-edge allergy correction and host of other safe and effective alternative therapies.
Dennis J. Courtney, MC, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Having just got the word, the Constitute Health Plan has a I've got to go, Roger.
We can do this. We can.
The equivalent of 5 fruit herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is a unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and hydrolyzed minerals from the Dead Sea with no added sugar. Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this, starting on gloomy Monday. Nonetheless, hey, you had a wonderful weekend, and we're going to have a wonderful week together. We're starting this week out with an interesting topic. Were introduced to compression clothing. It was for humans, and it was last month. Well, guess what? There's a compression clothing item. Not just you, but there's one for your animal, particularly your dog. And as it turns out, an interesting topic that, I think, actually has quite a bit of merit to it. You're going to find out from its inventor, Mr. Phil Blizzard, exactly what is Thundershirt and how that's supposed to help your animals. All my patients, and I'm sure many of you listeners have a very special relationship with your animal, particularly your dog, but you may have some problems, and you'll be hearing about what those problems may be and how to correct them through this thing called Thundershirt. We're Mr. Phil Blizzard right now. Let's say good morning and welcome to him. Good morning, Phil.
Good morning. Thank you for having me on.
Hey, I enjoyed really having you here. It was really odd. About 2 weeks ago, I did a show. I never knew about compression wear at all. And
well, you're not the only one.
Well, okay. And it was we had a wonderful show. I was introduced to compression wear for humans, and I learned an awful lot from that discussion. But within the course of the day, before the day was up, I got a call from the PR group. Jordan called me, and she said, hey, you're not going to believe this one. And she went into talking about compression wear for animals, And I thought, that was an awful lot about compression wear in one 24-hour period. I didn't know if I could really handle that amount of knowledge about compression wear, but okay, there's been a break. I can handle it now. Phil, let's find out about Thundershirt. Let's first find out about Phil Blizzard. Phil, what did you do? How did you invent this? And what's your background? What did you do beforehand? And, of course, I think I know what you're doing now.
Well, I came to this from personal necessity. I have a dog named Dosey. She's a 50-pound mutt, and she's been afraid of thunderstorms and fireworks since she was a puppy. Her symptoms aren't overly severe. She, she shakes, she pants, she puts the tail between the legs, she jumps up onto the bed in the middle of the night if a storm comes in the middle of the night, which I live in, I live in Durham, North Carolina, so that's a common problem in the middle of the night. So oftentimes, the way I would learn there was a storm was my dog would be planted on my chest in the middle of the night shaking. And we started looking for solutions early on. We visited several veterinarians. We got the common suggestions of sedatives, which is what most veterinarians will prescribe. And it's an appropriate solution for some dogs, but for most it really doesn't work very well. And that was our case. The problem with sedatives for fear of thunder is you have to anticipate the storm by at least an hour or so for the drugs to take effect, which isn't very easy to do for especially storms that might strike in the middle of the night.
Yeah, in the middle of the night. Absolutely.
And the other issue is that the dog remains sedated for 6 to 12 hours long after the storm has passed. And in the case of our dog, which our dog, by way of confession, we're terrible dog trainers, so our dogs spend quite a bit of time up on couches and beds. And when they try to jump off the couch, and Dosey tried to jump off the bed or couch while under the influence of the sedative, her legs would often collapse underneath her. She'd end up breaking a leg if we weren't careful. So we quickly set the sedatives aside and started looking for other solutions. So, and the next thing was behavior modification through dog training. There's a process called desensitization, which is basically exposing your dog to low levels of what scares her, in this case thunder, and slowly increasing the levels until they become tolerant of it. Excuse me, I'm fighting a little bit of a cold here. Hopefully my voice will hold out.
All right, you're doing fine.
So the problem with a lot of dogs is they won't react to recorded thunderstorms, which is the case with my dog. You can put a CD on a stereo and play a thunderstorm at any sound level, and my dog will just look at you smiling and not be too concerned about it. She knows the difference between the real deal and the recording. So that was a non-starter for us, and basically that left us with nothing for a while. We just dealt with it for 6-7 years, and finally, about a year and a half, 2 years ago, a friend of ours suggested using a pressure wrap, a pressure garment, like you referred to it. I was very skeptical about it. My background, I'm actually an engineer by training. Way back in the 80s, I got a degree from Champaign-Urbana, University of Illinois. And then I was in product development for a lot of years after that. I was actually doing product development for Ford Motor Company back in Detroit in the 90s, developing vehicles like the Expedition and the Mustang. So I'm a fairly technical-oriented person, so when I first heard about using a tight shirt for relieving anxiety, I was quite skeptical, and especially since none of my veterinarians had heard about it. The dog trainers I spoke to had never heard about it, but one night a storm rolled in. We figured, why not? So we pulled out actually one of my old T-shirts and a roll of packing tape, pulled on the shirt over Dosey, and wrapped it around with packing tape, and it was like throwing a switch.
It was that immediate, huh?
Yeah, and in about 60 seconds or so, her shakes were mostly gone, her panting slowed way down, and she actually laid down and basically rested through the rest of the storm. And we were amazed. My wife and I looked at each other, and the next time a storm rolled around, we tried it again, and it worked the same way, and basically each time thereafter it worked that way, and that's when I became intrigued and started doing my research just to find out, why does this work? How come no one knows about it? What's the science behind it?
We're going to get into some of that, but this is amazing. You heard it from just some other person. Nobody in the industry, no veterinary individuals, and nobody worked with animals ever heard of it, which is a little unusual. That for sure throws me back a bit, because you wonder, geez, just with word of mouth, some of that stuff has to circulate around the industry. It looks like it didn't happen in this case. But boy, was the guy right who gave you that tip. And there you are sitting with an animal that, the poor thing. And I know I had an animal, a dog, that had this very same issue. I didn't know what to do. I didn't even think about sedatives or any of the other crazy stuff. but you have really stumbled upon something that is potentially helpful to every one of our listeners here. Speaking of that, how many dogs actually have this kind of anxiety? I guess that's what you have to describe it. The noises are going off. They don't understand. They don't appreciate. It's because they can't make hide your hair out of it, I'm guessing, is what caused them to go so crazy on this thing. But is this a high percentage of dogs that have this reaction? Certainly most of the ones I've ever seen do.
It's a very surprisingly common problem. That was one of the first things I learned, started getting into this and asking around about it. There are literally millions of dogs across the U.S. that suffer from some form of anxiety severe enough for their owners to be looking for solutions. Whether it's fear of thunder or fireworks, those are a couple of the most common. On a percentage basis, that's probably anywhere from 5 to 10% of dogs have it bad enough where owners are looking for help. There are a variety of other anxieties, of course. Separation anxiety is very common. Travel anxieties, just issues within the car. Crating anxieties. The dogs are a lot like people. They find lots of different ways to get stressed, and they need help. They're complex little animals, and so we're just delighted to have a solution like this that's so effective for so many of these animals. And the worst part about a lot of these anxieties is that they can become very serious problems for the owners. And it's not only is the dog uncomfortable, but the symptoms of anxiety vary widely. You can have the mild symptoms. My dog's symptoms were relatively mild, and just shaking, panting. She's very unhappy, and that, of course, made us unhappy, but she wasn't causing any real damage. She wasn't requiring medical attention. But a lot of dogs, when they get into an anxious state, they can, we've had customers' dogs who claw through drywall, that self-mutilate, that jump through plate glass windows trying to escape the noise that's terrifying them, running into traffic. We even have customers whose dogs, during thunderstorms, would literally fall into seizures. So it can be a very serious problem. It can chewing up couches, that type of thing. So it can cost owners thousands of dollars and lost time and lots of other issues. So a lot of these dogs, unfortunately, end up abandoned in shelters or rescue groups. So
take off. They probably just take off in a panic. And don't even know where they are. Sure. Oh, goodness. Well, you said after you had done this a couple times, that you used a T-shirt and wrapped it up with some tape, and you got a positive response. You and your wife looked at one another and you realized, hey, there's something to this. And you said you went and you did some research. What did you research? How did you research? What did you find in your research that fueled the fire a little more and gave you maybe some scientific explanation for this? I'm anxious to find out what you found and where you found it.
Yeah, so we did what everyone does. I got online and started doing a lot of online research just to see what might pop up. And as you mentioned, you got into the compression wear a while back. I'm not sure in what category you were discussing it, but people with autism often suffer from persistent anxiety. And there is a woman by the name of Dr. Temple Grandin. She's a PhD in animal sciences, but she also happens to be autistic. And she very early on in her childhood realized that pressure helps relieve her anxiety. And actually one day when she was, I think, in her teens, she was going by a farm. She saw a large animal veterinarian using what's called a squeeze chute. They use these squeeze chutes when they're going to immunize cattle or do other procedures. And it's literally a big device that the cattle walk into, and then it compresses down on them to immobilize them. But Dr. Temple Grandin noticed that not only did it immobilize the cattle, but the cattle were noticeably calmed by it. And a light went off in her when she saw that, saying, boy, that would feel good on me too. So she literally went back to her home and started designing a machine that she could get into herself that would apply lateral pressure onto her. And she's now designed a machine that's been commercialized, and thousands of people with autism use it to help relieve their persistent anxiety.
Autism, I've never heard of such a thing. I'm going to have to hit the computer and Google that one up myself.
If you do a Google on Dr. Temple Grandin, you'll see her all over the place. She's also authored numerous books on animal behavior. I also came across a group of dog trainers called T-Touch practitioners. There's a woman by the name of Linda Tellington-Jones who's been around a long time, who's done some really remarkable work with all kinds of animals, not just dogs, but horses and reptiles and a variety of animals. But they've been using touch and pressure for a long time to relieve a variety of anxieties. and they would just basically do the types of homemade remedies, often using an ace bandage and just doing kind of a complicated wrap around a dog to apply the pressure and seeing good results to it. So that's another excellent example. Swaddling an infant is probably something similar physiologically to what's going on.
Yeah, I see that. Sure.
For any parents out there, I mean, I have 3 small children, and one of our child would just cry inconsolably when she was a newborn, and the only thing that would really calm her down would be to swaddle her, which was effectively applying pretty tight pressure around our child's body, and it just had an amazing calming effect. So there is a physiological response to this.
Yeah, tell me more about why do you think, or why do others who maybe have ventured off in this area, why do they think, and you also, that it works? How does it work? Any mechanism that's been elaborated?
There is not good science yet. I spoke with Dr. Temple Grandin. I've spoken with a variety of anxiety experts. There's not a good study pinpointing exactly what's going on physiologically, but Dr. Temple Grandin and the other experts speculate that it's releasing some kind of calming hormone, like an endorphin or an oxytocin. There's some response in the body that is releasing some sort of hormone that has a calming effect.
Well, that's as good an explanation as any. It's the results that's important, and these in those human cases, I can certainly see how important they would be, and certainly with the dogs that you end up dealing with, and in this device you called a Thundershirt. So, how did you go from a dirty old rolled up T-shirt with some tape to a Thundershirt, and how did that evolution occur?
Yeah, before we were even thinking about this being a business opportunity, I just started looking for, there's got to be an easier way to do a pressure wrap. And, of course, I came across the T-Touch practitioners, and I saw the ace bandages. And so we gave that a shot, but you pretty much had to be a Boy Scout or a Girl Scout to get those things on correctly. And they weren't something that you could leave your dog alone with because there's a risk of getting snagged or strangled with it. So that wasn't a very good solution, and there really weren't any good products like pulling on, they do have dog shirts and things out there that you can purchase, but most of them require pulling something over a dog's head or trying to thread legs through leg holes, or they just wouldn't apply appropriate pressure. So none of those things were working very well, so ultimately we just started to design our own. So what we wanted to accomplish was something that would be very easy to put on. Especially if your dog is already anxious, you don't want to have to be manipulating the dog in any way that the dog will become even more anxious and possibly dangerous to the dog or to the owner. So our product, you don't have to pull it over the head. You just lay it over the back. There are some simple Velcro straps. You just wrap gently around the chest area and then wrap it snugly around the torso. And that's really all we're talking about here is constant, gentle pressure. It doesn't restrict this pressure. Almost all dogs actually enjoy wearing these. You can see their behavior very quickly calm. It's not suppressing their behaviors. They're in general very happy wearing them. But something about this gentle, constant pressure, if a dog is anxious or fearful or overexcited, just has a real dramatic calming effect. And we've been doing this for just over a year. We're a young company. We just launched our product last May. But we already have tens of thousands of dogs around the world using them, and we see an 85% success rate with our customers.
Primarily dogs or other animals too? I'm sure that the Thunder thing is, how cats? Work with cats?
Yeah. Cats exhibit fear of thunder and fireworks as well, not to the degree that dogs do. We've had some anecdotal work with cats, and we see some good results, but they tend to resist wearing garments like this more than dogs do. We've heard, like, we haven't really pursued that marketplace, but we've had people that just called in and said, hey, I've got a cat, has this issue, I'd love to try your product. It fits cats well as well. So we've seen some good results, and we've also heard from some owners that their cat basically just froze and fell over when they put it on, and so they need to take it off.
Now, we don't get completely absorbed. In other words, there's not one of these for hamsters or any rodents like that, right?
No, we haven't gone down to that size. We do cover from Chihuahuas on up to like 2-pound Mastiffs.
I looked at the website, and actually the garment you put together, I'll use the word garment, it looks rather stylish. It's something that, maybe with a little more color to it, it could be easily sold as a fashion statement besides, because you really constructed it in a unique way, and it doesn't look too difficult, as you say, to put on. and with the Velcro straps just going around the back, and I'm guessing you cinch it up from underneath, you're not looking for extremely, very constrictive pressure. Just, you use the term mild pressure, light pressure. And that's all. That seems to do the job for you, huh?
Yeah, we like to use the term comfortably snug is all you're looking for.
Comfortably snug. Fair enough. Now these devices work like a charm when you rolled up tape around a T-shirt. And some of the things I've seen on your website indicate this is a pretty rapid fix. I mean, if you put it on, and you get it's pretty much immediate in most animals.
For most dogs, they respond within the first couple of minutes. Absolutely. We have had cases where the initial wearing application of the Thundershirt, you didn't see much at the first, but then during the second, third, and fourth, they started to see increased improvement, and over time, it got better and better.
And on your website, you can see, I mean, a lot of dogs are being transported and in a car. And this is another kind, you call it cage anxiety, I believe, on your website, which is crate anxiety. Yeah, crate anxiety, where I'm sure that's very common when you're moving your animal around in the and they're caged in like that in the crate. And I saw that it was immediate in the few cases that showed up on the website, and that's something that you don't have to, have it on a rare basis like a thunderstorm or once a year on the 4th of July. This is pretty frequent. This could be multiple times in a week. So does the shirt ever get to the point where the animal feels it's okay and they don't even need the shirt anymore, or does this always seem to be something that the animal's going to require over time, or don't you know?
What we've seen is that for some animals, I'll call it a curative effect. And here, I've spoken to a lot of different dog trainer experts and others about what might be going on here. And we've seen this with our own dog, where over time, the symptoms become less and less, and for some dogs up to the point where they no longer need any help for the issue. And this is what we believe is taking place. As an example of a thunderstorm, when a dog hears a thunderstorm, they had a fear of thunder, they get very upset and the symptoms show themselves. When you apply a Thundershirt, it allows them to experience the thunderstorm in a calmer state. So each time they experience whatever it is that troubles them, like a thunderstorm, in a calmer state, they become less and less fearful of it the next time they encounter it. So over time, as each time they experience it, it's basically desensitization using a Thundershirt. They experience it, they're calm through the experience, and then each time that happens, they become less and less fearful of what they were fearful of.
So, I mean, if it didn't lead to that, that'd still be okay, but because you'd have a solution. But I can see where the desensitization process over time could yield you an animal which could say to themselves, hey, why am I getting all worked up over this? How many times have I seen that thunderstorm now, and everything's just fine? And I'm thinking in their doggy brains, that's when they go, hey, no big deal, no big. Something like that, huh?
Absolutely. And then, like I said, my own dog, her symptoms have decreased markedly over the last year and a half as we've been using this, to the point where a lot of times if it's a minor storm, it's no longer needed.
All right. Folks, I told you, fascinating, is it not? You have the animals that may just require some of this. I'm sure you've never even heard about that squeeze thing that Phil heard about that gave him his initial test on this. Well, guess what? The testing is done. It's over, and there is a product. And you just might want to hear about how to get that product. Why don't we do this, Phil? Why don't we take a short break? When we come back, I want you to give website information, telephone information for those listeners who have an interest. I'm going to ask you about, now that you're well into this, and this subject comes up with many veterinarians, how they, I bet you they're buying the product like crazy because they were prescribing drugs before. Anyway, want to get that perspective. Also, some interesting ways that you see you get videos sent to you. I'm going to ask you about some of the more interesting videos you've been able to see when your product was used. Fair enough?
Absolutely.
All right, folks, there you have it. You're with Phil Blizzard. Really is an interesting topic today where I think many of you humans may benefit by having a much more calm animal in these particular situations. More about the Thundershirt when we return. Phil, we doing okay?
Absolutely.
Okay.
Are we on the air here?
Yeah, we're off air. They got the commercial thing going, and I hear it. You might not. And then we're going to come back. You don't mind taking questions, do you?
No, this is terrific. I apologize for my voice. I'm fighting a little bit here. And
No, you're doing great. There's nothing wrong with the voice at all. I'm glad the connection stayed as good as it did, and we'll be fine. We've got about 20 minutes left to go. We'll fill that time with either information coming from you or I'm pretty sure we're going to get some phone calls from listeners who want to ask you specific questions.
Terrific.
Okay, hang loose.
Equivalent of 5 servings of fruits and minerals. Thundershirt is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit the Spirit, a production of River Health. That's 1-800-442-3793. Call us now, 1-800-442-3793.
This is Thundershirt, Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow. It seems to be reasonable enough that no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health here on KHV 620, as we do it each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on this Monday version of the show. The sun is starting to come out, at least where I am. It'll break out where you are shortly. If not, I just hang loose in the range of the day. It's supposedly turn nice. We're having some wonderful sunshine brought to you today on how to deal with your pets, particularly your dogs, for a complex that I've got to agree I've seen all too frequently in animals that I've had growing up, and you may be having right now with yours. Our guest today is Phil Blizzard. He has been the inventor of a unique piece of compression wear, not for the humans now, but for those animals, especially dogs, called Thundershirt. And he's with us now. Say good morning and welcome to you. I think you're still there, right there, Phil? Still with us?
Still here?
Okay, yes. Before we take any more time, by the way, folks, we'll take any questions that you'd like to offer up for Phil. He's more than willing to answer your questions individually. 412-825-6262 is the number, as always, to get in on this. 412-825-6262. Now, Phil, for those listeners that are out there, how do they find out more about the product? How can they order the product? And, hey, how about sizing? I mean, you say you go from Chihuahuas up to Great Danes, I'm guessing. You got quite a few sizes to deal with, don't you?
Absolutely. We actually have 7 different sizes, from extra small for the little 3-pound Chihuahuas on up to the largest size for up to, the big St. Bernards and Mastiffs. It's very easy to get the sizing correct. You just do a quick measurement around the torso. The need for the Thundershirt is very adjustable to fit all different sizes.
Oh, yeah, with that Velcro, it's quite a bit of latitude. Nonetheless, you would hate to put the Chihuahua one on the St. Bernard. So come on, folks, come on. Get the measuring tape out. Take a look. I'm sure there's a sizing chart that you have for them, right?
Yeah, the easiest way to learn more about the product is just go to our website, which is thundershirt.com. And there are a variety of before and after videos, instructional videos on the website. There is a video even about how to take a measurement and how to put on a Thundershirt as well. And our phone number for those who don't have access to the web is 866-892-2078. We'd be happy to answer any questions anyone has.
866-892-2708, I think I got.
I'm sorry, 2078.
2078. Now, Phil, I've been on the website. Certainly caught my attention I had a number of, and ladies and gentlemen, I'd really encourage you to dial up the website. You'll see some pretty interesting video and some pretty immediate responses from dogs who, were exhibiting all these forms of anxiety symptoms, and immediately had them changed with the application of these Thundershirt. And you'll want to see those because it'll definitely resonate with you. If the words that Phil's using is having some difficulty in doing just that, resonating that is. So Phil, you've probably had a lot of these videos sent to you to sort of show, well, look what it did in my case. What are some of the more interesting ones you've seen?
We get them all the time, and if you go to our website again, and even on the landing page when you first arrive there, you can see a couple of videos on the home page. We get them sent in from our customers frequently. The first one you see there for Thunder is a more typical example of a thunderstorm anxiety. It's a little Boston Terrier named Joe Stain. That when thunderstorms arrive, he would want to run to the bathroom and lay down and just shake and pant. And you can watch it. It's kind of a heartbreaking little video seeing him pulse with shake. But when they put the Thundershirt on, just completely calm down, heads out of the bathroom, and pretty much sleeps through some of the future storms. That's kind of a somewhat typical response for kind of an average fear of thunder. But some of the more interesting ones on the same page there is a barking video, before and after for problem barking. So it's not just for fears of thunder.
Yeah, that's right. I saw a number of videos where barking was the issue, and that drives you crazy. I mean, if they're shaking, that's one thing. You feel bad for them, but it's not really bothering you, if you know what I mean. But when they bark, that can really break.
If you take a look at the barking video on our homepage there, it's a great before and after sent in from actually a couple of youth psychology professors that have a couple of shih tzus that they picked up a few years ago. And these dogs are just crazy problem barkers. If a visitor knocks on their door, these two dogs would start barking and pretty much not stop until visitors left. They would end up having to just lock the dogs in a back bedroom for the duration of any company. And they had tried all kinds of different training techniques without any success. And it was a very frustrating problem, especially given that they're psychology professors and thought they could probably figure something out. But after about 30 seconds of wearing a Thundershirt, these dogs turned into different dogs, and that's what you can see in this before and after. What you're seeing there on that before and after is basically the first application of using Thundershirts with these dogs. It just immediately calmed them down. The barking pretty much completely went away, and they became good little citizens in the house as opposed to the barking terrors that they were previously.
I can just see a couple psychologists just losing it on their end and unmercifully beating their dogs. I got imagery that really, it's not fair, but that's what I saw. I had to repeat that. I would absolutely, yeah. So barking, and that's probably, it happens every day, in a car, out of a car. They're just those particular dogs that, I mean, this is how they express their when their antennae go up, they start yapping away, and it will drive you crazy. It'll cause you to do some maybe unkind things to animals. And so this is one way that you've noticed that you can count on contending with it and doing quite well, making you feel good, making the animal feel a whole lot better.
It's a very easy approach. So we've seen some great results with problem barking, and as you said, the reason for barking can be very varied. Sometimes it's a symptom of anxiety, sometimes it's just a dog that's overexcited. But whatever the issue is, many times just this gentle, constant pressure will have this calming effect and reduce the problem substantially, if not completely.
Wonderful.
And some other interesting videos. Repetitive motion disorders are a common problem with a lot of dogs. Things like spinning, facing their tail, or pacing back and forth types of issues. And we've seen some great results with that. There's a little video available on our website, and I believe it's on YouTube as well, if you search for Thundershirt, where a little beagle that would just constantly spin to the left. Whenever they try to walk off leash, this dog would always just want to keep spinning to the left. It had some sort of neurological issue that just caused it to be a compulsive spinner. And some trainers have been working with it. A trainer came across our product, thought they'd give it a shot, and it just had a remarkable effect for this little dog as well. After about 60 seconds of wearing it, the spinning basically went away, and the dog straightened out and started walking. much more normally and paid much more attention to the owner and its environment instead of just worrying about having to go in circles.
There you have it, folks. If you want to get on some of this discussion and ask personal questions with respect to your dog and how I might be helped by this thing called a Thundershirt, don't forget we've got a book. About 10 minutes left. 412-825-6262. 412-825-6262. When we hear you knock on the door, we will let you in the store. Speaking about these professionals, trainers as well as veterinarians, the product's been out a while now. I'm sure it's really gaining a lot of success from the pockets of the country where it's better known. What kind of feedback are you getting from the professionals? What kind of feedback do you get, for instance, from the veterinarian professionals as well as trainers? Because they see the numbers of animals they see are so many compared to yourself. They would have had to develop their own opinion about this. And do they use the product? Do they sell the product? How do you know that it must be working fine? Because I got all these professionals using a product that just worked on my dog to begin with. They're using it every single day on a whole group of animals.
Yeah, absolutely. One of the first places people go when they're having an anxiety problem with their dog is the veterinarian. So veterinarians are very familiar with the issues, and by and large, they've been unsatisfied with the solutions they had to offer. Normally, all they had at their disposal in their toolbox was sedative. And they would tell you first off that this is not a great solution. My own veterinarian, when I first took our own dog there 8 years ago, that was their response: is we can give you sedatives, but there are drawbacks to it. So they are very aware of the problems, and they are actively looking for better solutions. So we've been very pleasantly surprised by the reception we receive from the veterinary community. We just started marketing to veterinarians last July. We started going to some of the big veterinarian conventions across the country. And just in our first year, we have well over 1,000 veterinarians now that have seen good results and are now recommending them to their own clients for anxiety issues. It's a great group to work with. They're very knowledgeable about these issues. It's been interesting, just as I come from an engineering background, as we would be presenting or exhibiting at one of the conventions. A lot of veterinarians, they'd walk by our booth, they'd see our sign, basically advertising a drug-free solution for dog anxiety. And first they'd walk by, and then you see them stop, and then they'd come back and look at you and say, okay, this is a big problem in my practice. I'm not sure I see why a shirt on the dog is going to help relieve it, but I'm interested and I want to learn more about it. So we start there. They try them on a few clients, and they see good results, and we go from there.
And so you, probably much to the person, it's only been rare that maybe a veterinary company said, oh, I am familiar with that, I do this and this and whatever, or is it pretty much a blank slate out there? The veterinarians are as surprised as anybody else that something like this can and could work. I know they would gravitate toward it because they're not really getting good results with that, and they're having problematic results when they use the drugs to get the anxiety under control. Any interesting conversations come up at the booth with the practitioners who may have heard of the concept before? First of all, did that ever happen?
Well, yeah, absolutely. I mean, a lot of them, I'd say 99% of them have never heard of using this as a solution for canine anxiety for dogs. But as soon as they started thinking about it, they say, well, I am familiar with Dr. Simple Grandin and the work she does with people with autism, and I never thought about that as an application for dogs. Or they're familiar with, there's a lot of special needs educators that use these compression shirts, I think that you mentioned before, on children with a variety of different behavioral disorders. Compression shirts and weighted vests, and a lot of them are familiar with those types of applications, and a lot of them would come up to and just bring up, is this like swaddling an infant? That makes some sense to me as well. So they had different things they could look at to see kind of practical applications or things they've seen in alternative applications, which made sense to them that this might work for dogs, which opened the door to them giving it a try. And then just the fact that this is completely safe product. It definitely will do no harm to the dog. It's much safer to try than medication. But medications always risk potential side effects, whereas there's no possible side effects. It's very comfortable for the dog. The worst case here is the dog doesn't respond, and we also have a money-back guarantee with our product. So there's really no financial risk.
Good.
We're trying this as well.
So that's the veterinarians are the ones that went to the pill. We have our own corollary with respect to human issues where the medical profession is well known to heap up drugs and end up potentially causing more problems than they do correct the issues you initially see a doctor for. I'm a little more interested in the non-medical side of it, and those dog trainers to me would be the group that I would go to. They're in the trenches. They're where the rubber hits the road every single day. They don't have the luxury of prescribing a drug, and so how do your dog trainer that ends up using the product, what do they say about this? Because they never did have the drug. They may have told you to go get a drug, but that wouldn't be something I'd expect a dog trainer to do.
Absolutely right. And again, other than vets, the next person most dog owners would go to is the dog trainer. And they would try different behavior modification programs, and they've been extremely open to this, especially when they start seeing a little bit about, if they weren't already familiar with these C-touch practitioners, these dog trainers that have been using, these paste bandage types of wraps for years. They're very open to trying it when they see the types of responses we've received from veterinarians, when they start looking through, the literal hundreds of endorsements and customer testimonials that we received in just our first year in operation. They're excited about the product. And another application of this that they get particularly excited about is just this calming effect is useful in any training environment. So if you have a dog that's just overexcited, and most of the time, especially if you get into a multi-dog training environment, dogs tend to become very reactive to other dogs around them, and it becomes difficult to train them because they're more excited about the 10 other dogs that are in the class with them, or all these new people they haven't seen, than actually paying attention to what their owner is trying to teach them. And so what trainers are seeing is that by having dogs wear these Thundershirts during training, the dog becomes calmer, the dog becomes more focused, they become more receptive to training. So they see better results with their training overall, even if it's not something specific to a thunder anxiety or a separation anxiety. So there's a lot of different applications that we're seeing really interesting results with, and the trainers are definitely one of our best channels now for reaching out to dog owners.
I see an interesting term here. I always love when I see terms from sort of like how the people who are over it would describe as metabolically challenged, the kind of clean words that you use. I see a clean word here used in some of the literature I have in front of me. Leash. Does your dog have bad leash manners? Okay. I'm going to imagine that really cleans it up a lot, because some of these animals on a leash, I see them dragging their owners down the street, and I don't know who's going to win that one, but some of these animals are quite large, and the young ladies holding the other end of that leash are quite small. They're getting dragged down the sidewalk. Leash manners. Now, that's an interesting term. Does it turn out that this product would work just for the typically going to take the dog out for a walk? Let's get the shirt. Could you see that happening?
Absolutely, and lots of it. The leash manners can include things like absolutely the dog that's just constantly pulling on the leash. It can help to reduce that type of tugging. But also dogs that are just reactive as you're walking down the sidewalk, the dog that has to, run up and try to jump on every person or dog that you walk by, or the dog that starts barking at dogs as you go by, or worse, that we've seen this again have this dramatic calming effect to make them a much better behaved dog when encountering things that would otherwise overstimulate them or cause anxiety symptoms.
Outstanding. Wonderful. By the way, I just have to ask, you got the cutest dog. Is this your dog in your literature? Is that, what did you say your animal's name was?
Dosey.
Dosey. Is it Dosey that's not, you got pictured up in front?
Dosey's on the homepage of the website. Yeah, it's a mutt. I call it an accidental golden doodle. It's half golden retriever and half standard poodle.
Okay, I am looking at Dosey. What a cute animal she really is. That's great. That is wonderful. Look, we got about a minute or two to go. As we're trying to pull this close, rather than being abruptly interrupted and have to say goodbye, I'll let you take the floor just for a few moments and sort of recap as a person who stumbled on something, made it work, and I got a feeling that as time moves on, you're going to be nothing more but more successful and more successful. And I hope you get really rich over selling this Thundershirt concept, which I know wasn't your original intention, was just to help animals. As we get to the ending of the show today, bring us to a conclusion on your high note as you see it with respect to anxiety in dogs?
Again, it's a remarkably common problem. Millions of dogs suffer from this. It can be a very difficult problem for both the dog and the dog owners. What's been tremendously rewarding for me personally in doing this business is just the ability that we've had to help so many dogs across the country. We've worked with hundreds of shelters and rescue groups across the country, donating Thundershirts and working with them to try to relieve the anxiety problems. As you can imagine, they see a much higher incidence of anxiety, given that a lot of these dogs end up being abandoned to shelters and rescue groups. So it's been very rewarding to be able to help a lot of these dogs deal with these very difficult problems and become much more adaptable and find permanent homes. And to do so in a way that's just very inexpensive, very low risk for the dog, completely safe for the dog, and just the customer testimonials that we've been getting back all the time, it's been a fantastic experience for us. So we just want to encourage people that if you're having this problem, please consider this as an option. You don't have to commit lots of time, you don't have to commit lots of financial resources. There is an easier approach to try that sees great results nearly 85% of the time.
85%, that's another great question I forgot to ask. How successful is it? 85% is a pretty doggone high number.
Absolutely, 85% success rate. And again, we offer a money-back guarantee for those few dogs that don't respond for one reason or another. We're more than happy to refund the purchase price, and any of these Thundershirts that do get returned, which are very few, they just immediately get donated to shelters and rescue groups and help dogs in need. So,
can't lose on this one. As we close now, why don't we finish up with, once again, your website and your telephone number so that our listeners can take it from here.
Okay, toll-free 866-892-2078, or you can find us at Thundershirt.com.
Thundershirt.com. Go to that website, folks. You're going to love seeing those little videos there. Certainly.
I'm sorry, we never mentioned the retail price. I apologize. It is just $36 for our standard gray Thundershirt, and you mentioned the styling issue. We do have a couple of new styles that have come out. One's a navy blue with white stripes, and then there's a pink version.
Oh, you went for the style. Okay, I love it. I love it already. It's not just this gray one I see. All right. Phil, thank you so much. Good luck to you and your wife and your Dosey, okay? And I hope you can make more animals than just a few you already have been dealing with, happier and their owners too. We'll see you, Phil.
Thank you very much.
Mm-hmm. There you have it, folks. Thundershirt. Yeah, I learned a lot. We're Bronco down right now, ladies and gentlemen. We'll be getting on out of here. We'll see you on Wednesday when Dr. Eric Shapiro comes back with us. Until then, this is Dr. Dennis Courtney saying so long for an impact on your health.